Good afternoon, everyone. Hi, I'm Liz Krueger. You might live in my Senate district and you might not. You are always welcome to any events we're hosting. This afternoon, okay, you'll notice already, I have a bad head cold, which is why my voice sounds bad, and you might hear some coughing. You can't get a cold from me on Zoom or Facebook, so you're all safe. But this is my final webinar for 2025, and it's benefits and older adult centers and the impact of federal funding cuts on these programs, which are so important to us. And we are so proud we have so many good programs and benefits and senior centers here in New York City. This afternoon, we have several excellent experts who we'll be welcoming on, and they will both present to us. And then we will, as usual, have a Q&A. Many people have already sent us questions, but you can still ask more questions through either system you're using to participate. If you're on Zoom, you click on live transcript in the meeting controls to start viewing closed captioning. And if you're on Facebook Live, you'll see a settings button in the bottom right-hand corner of the video. Click on CC for closed captioning to activate the process. We're recording this forum, and everyone who's RSVP'd will automatically receive an email with links links to the event video, the resources that are posted in the chat, and the PowerPoint presentations within a few days. So, of course, you can write things down as you hear them, but don't feel like you have to be writing so much that you can't just listen, because you'll get all this material in a couple of days. Excuse me. Oh, not ideal situation. Sorry about that. Moving on to today's event. The federal budget bill passed by Congress over the summer included cuts to many benefit programs that older adults rely on, including SNAP and HEAP. It also put in place new work requirements for people under age 64. These cuts will not only impact older New Yorkers directly, but also older adult centers and other providers that serve older New Yorkers. Today, we will hear from expert presenters on the impact of these federal changes and on our older adult centers throughout our communities and the services they provide. First, we will hear from Kim Lerner, Director of Benefits Outreach Programs at LiveOn New York. And if you watch my webinars, you'll notice that LiveOn has participated in quite a few of these important programs. And then we will also hear from Jeremy Kaplan, Executive Director of Encore Community Services, a terrific program that serves a section of my district and multiple other areas. As I said, we've received some questions already, and anybody who wants to add to them can feel free during either Kim or Jeremy's presentation, and then I will moderate a Q&A section with them both. So now I'm going to thank Kim and Jeremy for being with me, and I'm going to pass it to Kim, and she'll pass it on to Jeremy, and I'm just going to go off screen so that we can all focus on them. Good afternoon, Kim and Jeremy.
Good afternoon, Senator Krueger. You are a trooper, I gotta say. Good evening or good afternoon, everybody. It is so great to be with you. And of course, first, I want to thank Senator Krueger for inviting me to be here and for being such an avid champion for older adults in New York and being an essential partner. I also want to thank her amazing staff who go well above and beyond when trying to help constituents, and it really is a pleasure to work with them. As Senator Krueger said, my name is Kim Lerner, and I'm the director of LiveOn New York's Benefits Outreach Program. And I'm going to start all this just by telling you a little bit about LiveOn New York, because many of you may not be familiar with us. LiveOn is a nonprofit umbrella organization that represents 107 member agencies that provide programs and services to older New Yorkers. These include older adult centers, case management agencies, NORCs, and many others. We are dedicated to supporting our members and the older adults that they serve by focusing on three main areas. First is our advocacy and policy work, which works on the city and state level to ensure that our members and older adults' voices are heard. We also provide professional development opportunities to our members' staff. So those are social workers, caseworkers, case managers, and through training and workshops that are relevant to their work with older adults. And last, but certainly not least, is our benefits outreach program, which provides screening and application assistance for the benefits that we're going to talk about today and many more. In addition to helping with application assistance, we also support people throughout the benefit application process, and also we troubleshoot and resolve issues that may arise when somebody already has the benefit. And this is to ensure that their benefits are not disrupted. And we're going to talk a lot about disruption this afternoon. So today, we're going to focus on what the new law will mean to older adults, as Senator Krueger said, and many of whom rely on SNAP, Medicaid, and Medicare. HR 1 is often discussed in glowing terms of being having federal savings or having economic growth. But the reality is that many of those so-called savings come from shifting costs and risk onto people with the least financial flexibility, and that includes older adults living on a fixed income. So before we go into the weeds, let me give you an overview of what we're going to talk about today. Next slide, please. And the next slide after that, please. There we go. No, back. Thank you. Okay, so first, we're going to talk about the foundation of all of this, and that is why benefits matter in the first place. These programs create stability by helping to pay for food, healthcare, and housing needs. And then we're going to tackle the disruption that I just mentioned, how HR 1 will change the landscape of benefits access. On paper, these changes can look technical, but in real life, they decide who qualifies and how hard it will be to stay enrolled. And then we're going to move on to the impact, and that entails what older adults are going to experience, the confusion, the delays, the benefit loss, and the challenges that community-based organizations and programs will need to confront when the demand spikes and the system is stretched to its limit. And finally, we'll talk about the path forward and policy and advocacy priorities. Next slide. Now, for most older adults, maintaining dignity and independence is a high priority for their mental and physical well-being, and that's true for most of us. Public benefits assist them by helping to provide a foundation of stability. Crucially, they prevent crises and keep any existing conditions from worsening. When these supports are in place, older adults are more likely to stay healthy, secure, and independent. So let's talk about the basic needs and the benefits that provide this stability and that are relevant to our conversation. First, there are benefits that assist with housing stability and basic safety. So we're talking about being able to afford the rent, mortgage, and afford utilities. And so the benefits, of course, that help with housing costs are SCREE and DREE. And for utilities, it is HEAP, which is what we're going to talk about later on. The next is food insecurity, of course, and there's no better tool to combat food insecurity than SNAP, the Supplemental Nutrition Assistance Program. When older adults have reliable access to food, they can manage chronic conditions like diabetes and heart disease. And when SNAP is disrupted, we see people skipping meals and stretching food in ways that directly harm their health. Next is healthcare, and of course that means Medicaid and Medicare that we're going to focus on. And then there are, of course, the benefits that provide income stability, like Social Security Disability, SSI, and also included are programs that support older adults as well, like the Senior Community Service Employment Program, which is the largest federally funded program connecting older adults with employment. So here's the key point, and you're going to hear this all through the conversation tonight. As you'll see, many of the cuts come in the form of administrative barriers and decreased funding to the states. These will affect access to these benefits. And administrative barriers can be just as harmful as funding cuts. Confusing notices, frequent reporting, complex renewals, they all can keep people from accessing benefits. And for many, without those benefits, somebody who was previously stable could be pushed into a crisis. Next slide. Okay, so as we know, this law is a multi-front challenge to stability. The implementation of this law will result in multiple pressures hitting at the same time. And when you layer them all together, the impact on older adults is bigger than just any one policy shift. First, there's the funding and eligibility cuts, where people who used to qualify are pushed out of the program. Next, the administrative burdens, the increased requirements that make the process far more complex and burdensome. Then the new work requirements that, of course, also increase the risk of people losing benefits because they may have difficulty complying or can't keep up with all the documentation that's required. And so even though they meet the eligibility criteria for a benefit, they lose the benefit. And finally, there's the law. The law restricts immigrant access to benefits. These are severe new exclusions across programs that will destabilize individuals, families, and communities. And again, I want to say more about the administrative burdens here because, again, they're going to be a thing throughout this talk and will affect everybody with benefits. When federal funding is cut or made more restrictive, the impact flows directly from the federal level through the state down to the local government. And New York will be forced to absorb a larger share of costs or make difficult trade-offs. In practice, this often means pressure downstream, so to speak, limiting program growth, tightening eligibility, slowing approvals, or reducing funding to city agencies and community-based providers. For New York City, this translates into fewer resources to meet a growing need. City agencies like the Human Resource Administration that administer many of these benefits are going to face higher caseloads with less flexibility, and nonprofits are going to be asked to do more with fewer dollars. So we're inevitably going to see longer processing times, fewer staff available to help, and severe time constraints. So even people who qualify can lose access to benefits because the system becomes much harder to navigate. Next slide. So I'm going to begin first with SNAP, Supplemental Nutrition Assistance Program. Approximately 1.8 million people in New York City rely on SNAP, and that includes hundreds of thousands of older New Yorkers. Many are living on a fixed or limited income that have not kept pace with rising costs like rent, food prices, and medical costs. SNAP has long been one of the most effective anti-hunger programs we have, if not the most effective program. SNAP plays a role in being able to manage chronic conditions by eating healthy food, and it avoids possible or impossible trade-offs between food, utilities, and healthcare. And as we saw last month with the government shutdown, when SNAP allotments were delayed, the inevitable results were hunger, fear, and anger. And that really made clear, crystal clear, that SNAP is not just an optional support. When access to SNAP is interrupted, New Yorkers suffer and feel the impact right away. Under H.R. 1, states are projected to lose $186 billion in federal SNAP funding through the year 2034, while being required to take on a much larger of the program's administrative and benefit costs. Next year, that share will be 25% larger, and by 2027, states will also absorb a portion of SNAP benefit costs. Another major change affects how SNAP benefits keep up with food costs. This is called Thrifty Food Plan. The amount of SNAP allotment is based on this plan, which estimates the cost of a minimally nutritious diet. And in 2021, this plan was updated for the first time in nearly 50 years. And this resulted in a 21% increase in benefits. And that one update kept 2.3 million people out of poverty. including many older adults. So you can really see the importance of SNAP just by those numbers. Under HR 1, future SNAP increases will be tied to general inflation, not the actual cost of food. Grocery prices often rise faster than overall inflation, which means that even if benefits technically increase, they buy less food over time. Older adults may remain enrolled in SNAP, but they're still going to experience food insecurity because benefits no longer last the full month. And this will be disastrous to older adults on fixed income. HR 1 also expands the SNAP work requirements, which we mentioned earlier. Beginning in March 2026, SNAP recipients aged 18 to 64, people who are able to work and without a child in the household under 14, will need to show that they're complying with the work requirement. And that requires 80 hours per month of work or qualifying activities such as job training or participation in volunteer or community service. If they don't comply, they will only be eligible for SNAP for 3 months out of a 3-year period. It is quite punitive. And to make things more onerous, the work requirement will entail strict reporting rules, with many people having to provide proof of the work on a monthly basis. While many older adults between 55 and 64 are already working, there are a number of people who have limitations or disabilities or they're caregivers. And fortunately, in these situations, there will be a number of exemptions to the work requirement available. And that includes those for caregivers, for people with physical or mental health challenges, and a number of others. We have heard from HRA, the Human Resource Administration, that they are going to help people find exemptions. They're very keen to do that. So that is good news. But unfortunately, some people who were exempted previously are no longer exempted, and that includes veterans and the unhoused. So they will lose the exemption and will need to comply with these work requirements. As soon as these requirements go into effect, people will start having to comply, as I said, in March. But there are people who will not have to comply immediately, and that is for people who are receiving SNAP now. SNAP recipients who are receiving benefits now will need to comply at the time they need to recertify their SNAP benefits. So it won't happen immediately. Others have 3 months to start complying. And if they don't, that is when we'll begin seeing people lose their SNAP. And that's estimated to begin sometime in June. And the work requirements don't only affect SNAP recipients. On the administrative side, all these work requirements will also significantly increase the burden on HRA staff, adding layers and layers of verification, monitoring, and other processes, just keeping people in compliance with the program. So this is going to significantly strain an already overstretched workforce, and it will slow down service provision for everybody. Also, HR 1 significantly restricts SNAP eligibility for non-citizens. That means refugees, asylees, survivors of human trafficking, and others who are lawfully present. That means lawfully present and have lived here for years will not be eligible for SNAP. And for older adults in these categories, losing SNAP can mean immediate food insecurity and increased reliance on emergency food pantries. And another issue that I wanted to bring up is the impact on EBT skimming. And many of you may have heard of EBT skimming. It's been happening since when COVID stopped or was petering out. And skimming is when thieves steal someone's SNAP benefits electronically, often without the victims realizing it. And this is done through compromised card readers at the point of sale when you swipe your card, or online fraud. In the past, when benefits were stolen this way, federal funds were available to replace those stolen benefits, at least partially. But under the current changes, there's no longer guaranteed funding for these replacement benefits. And that means if a SNAP recipient benefits are skimmed, their food money for the month that they are losing their SNAP are gone, and there's no replacement. So taken all together, these SNAP changes make food assistance less reliable, harder to maintain, and more fragile, even while the demand increases. Next slide. And then we'll turn to healthcare. And I will say, I know that Senator Krueger's roundtable, I believe it was in October, focused on Medicare and Medicaid. So I'm not going to go deep into those benefits, but I did want to just point out a couple of things, especially for people who may not have been on the call. And healthcare is really an area where HR1 changes are especially significant, and for some older adults, devastating. HR1 cuts approximately $1 trillion from health programs, the largest rollback of federal support for healthcare in American history. And an estimated 11.8 million people in the US will lose their health insurance coverage. HR1 also makes a significant shift by restricting Medicare eligibility for lawfully present immigrants, including refugees, people granted asylum, people with temporary protected status, and others. The fact that they have worked for decades in the United States, the fact that they've paid Medicare payroll taxes, raised families, and contributed to our communities means nothing. Under this change, it does not matter. They are deemed ineligible solely based on the immigration status. And ultimately, these changes redefine who is deemed worthy of healthcare support. For many older immigrants, this is severely going to sever access to a program at the time of life when healthcare is most essential. And I just want to touch very briefly on expanded Medicaid, which is Medicaid that you receive from the marketplace through the Department of Finance. I'm sorry, Department of Health. So that coverage is generally available to older adults, to adults ages 19 to 64 who do not receive Medicare. This enables many people 50 through 64 years old to receive affordable health care through the availability of enhanced premium tax credits. Now, I'm sure you've heard for a couple of months now a lot about these premiums and the increase. So these premiums lowered the monthly healthcare premiums, which were instituted by the Biden administration. But unfortunately, these credits are temporary and will expire on December 31st. And where are we now? We're at December 16th. So it's coming down the wire. If they do expire, premiums will rise sharply. And for somebody ineligible for Medicare, higher marketplace premiums can put healthcare coverage completely out of reach. There are also procedural changes as well, including ending automatic re-enrollment and shortening enrollment period during which one can choose new coverage. Each of these changes increases the chance that people are going to lose coverage simply because they missed paperwork or they missed the deadline. And just one more issue about having to do with Medicaid. And that is regarding how HR1 is going to affect home care, which of course we all know is prohibitive to pay out of pocket. Currently, there are 16,000 older adults in New York State on the waiting list for home care and other supports that enable people to age in their home and community. The Medicaid funding changes under HR1 strain the system further, inevitably leading to an increase in the waiting list. This may directly affect whether someone is able to remain in their home or not. Next slide. And on to HEAP, which I mentioned earlier, the Home Energy Assistance Program. This is a program that assists with energy costs. And this program, the need for energy assistance is often overlooked, but for many, it can really be the difference between a safe home and a dangerous one. So HEAP will help low-income households pay for heating and cooling costs. It also prevents utility shutoffs and helps people maintain safe temperatures during extreme weather. For those living on a fixed income, HEAP can be a lifeline. Unfortunately, recent federal actions signal a major shift away from support for this program. Back in April 2025, staff at the United States Department of Health and Human Services who administers HEAP were fired, weakening federal capacity to manage and support this program. And in fact, the president's budget called for the elimination of HEAP altogether. Fortunately, that has not happened, but HR1 reduces federal HEAP funding by nearly $2 billion. And this is a substantial cut to a program that can't meet demand as it is. In New York State, HEAP regularly runs out of funding, leaving eligible households unserved. Now, having said all this, there is some good news, and that is for cash assistance, which is very helpful for very low-income people. There are no cuts involved with cash assistance. So that benefit is available with no changes to access. However, as with all of these benefits, the cost burden on the state will undoubtedly affect the system down the line, and especially among agencies that administer this benefit. Now, having said all of that, I wanted to take time and mention that many older adults especially are already wary about applying for benefits, especially due to stigma and the difficult application process. So HR 1 will have a further chilling effect on access to benefits even before all the policies are implemented. People stop applying, they stop renewing their benefit, or they avoid programs that they are eligible for, not because they don't need help, but because the systems feel intimidating, risky, and unforgiving. So with all that, you may say, is it even worth it? Is it worth it the trouble to go through this system just to get benefits? And yes, it is. Income, food, housing, and healthcare, these things are not luxuries. Everyone deserves these necessities as they grow older. They deserve to live their lives without constant worry, not having to choose between groceries and medication, or between paying the rent and keeping the heat on. We all deserve dignity. Dignity means independence, to stay in our homes if desired, to make our own decisions, and get support when needed without feeling ashamed. I guess my final word and most urgent thought is, please do not let these changes deter you from applying for benefits or from keeping benefits. You do not need to navigate all these processes and these burdens alone. Please reach out for help, ask questions, and get support from trusted programs or advocates such as LiveOn New York or the many other wonderful organizations that are available in New York City. It's very crucial that you know that you are not alone. So with that lecture done, I'm going to continue the conversation by handing it over to my colleague, Jeremy Kaplan, who is the executive director, as Senator Krueger said, of Encore Community Services. And Encore is one of our treasured members. Hi.
Hi, Kim. Hi, Kim. Thank you so much for that. I learned a lot just now. Good afternoon, everybody, and thank you, Senator Krueger, and your entire office for convening this very important conversation. It's a true honor to join your older adult roundtable. Again, I also want to acknowledge my colleague, Kim Lerner at LiveOn New York. LiveOn is such a vital partner in fighting for the rights and stability of older New Yorkers. Kim just walked us through the foundational role that benefits play in preventing crises and how specific policy changes are disrupting that stability. And now I want to take you to the front lines. My role as a community-based organization leader is to show you the ripple effect that these policy changes can have on the ground, the real-world impact on our direct service providers like Encore Community Services and so many others. And for those who may not know us, Encore Community Services has been working to improve the quality of life for older adults in New York since 1977. Our mission is to ensure that older New Yorkers can live with dignity and independence. We are considered a community care organization because we provide and convene non-clinical services within the community to help older adults thrive. We run a large variety of safety net programs, including older adult centers, which, as many of you know, are essential community-based hubs that provide congregate meals, benefits enrollment, care assistance, arts, culture, recreational programming. Home-delivered meals for frail and isolated people who are unable to leave their homes. At Encore, we freshly cook and serve about 20,000 meals every single week between our senior centers and our Meals on Wheels program. We also provide care planning and case management to help older New Yorkers navigate incredibly complex systems. And finally, we have supportive and affordable housing. And I do want to give an extra special shout out to Senator Krueger because our Aging Through Arts Center, which is one of the largest older adult centers in the city by volume is a cooling center. And unfortunately, the air conditioner was busted. And the city of New York didn't have the capital funds to help us, but Senator Krueger found that money at the state Senate, and that contract is being registered, and we will have a brand new air conditioner for folks in Midtown soon. So thank you, Senator, for that. Now, these services that I just mentioned are the foundation of stability for thousands of older New Yorkers. But when the federal safety net is intentionally frayed, the strain on our local system becomes just unbearable. We're seeing a surge of urgent needs. And I want to explain what that means for our staff members at community-based organizations and for older New Yorkers. Kim just described the federal benefit disruption: less funding, stricter eligibility rules, and mountains of new paperwork. This creates a serious problem for community-based organizations, and I call it a double whammy. So on one side, the needs of older adults are immediately increasing when those federal benefits like SNAP, Medicaid, and HEAP are cut or disrupted. The result is a surge of unmet needs at the doorstep of older adult centers. On the other side, our ability to respond to this growing crisis is paralyzed because the Older Americans Act and local government agency funding is essentially flat. The Older Americans Act is the legislative cornerstone of our national aging network. It provides the funding and the requirements for programs like older adult centers, our home delivered meal programs, and our core case management services. These programs are the very systems designed to absorb shocks to the from federal cuts. But when Older Americans Act funding is stagnant and demand is skyrocketing, that foundation is strained. Now, it's important to note that the existing network of nonprofit community organizations in New York City is already very stressed. NYC Aging, or the Department for the Aging, is the lowest funded agency of all New York City agencies, receiving less than 0.5% of the city budget, despite serving the largest and fastest growing population. About 75% of the Department for the Aging's funding comes from city tax dollars, and the rest is a combination of state and federal dollars. So when individuals' federal benefits are cut, it places a massive strain on an already stressed local safety net system. And the result is a surge of urgent, unmet needs that we simply cannot keep up with. Ian, next slide, please. The human cost is instant and it is painful. Losing a benefit is not just a bureaucratic inconvenience. It is an immediate threat of hunger or freezing or homelessness to an older adult on a fixed income. Now, keep in mind, organizations like Encore Community Services are typically funded by the city to provide just one meal a day, 5 days a week. Now, we partner with other organizations like City Meals on Wheels, and we also fundraise to provide meals on the weekends. Benefits like SNAP for older adults truly do what its name implies. They supplement the one meal that we're able to provide through public funding. Now, let me share a story with you about a guy named Wayne. Wayne is 72 years old, an Encore client, and he's homebound. This means that he relies entirely on our home delivery meal program for his primary source of nutrition. He also relies on SNAP to supplement the modest Social Security that covers the rest of his food needs. Now, recently, Wayne has been severely stressed because of new monthly reporting requirements that are being implemented. Wayne, who has difficulty with complex paperwork and reading fine print, fears that he may miss a deadline and that the SNAP benefits that he depends on will be immediately stopped. Now, I know Wayne because earlier in the fall, I decided to take on a personal challenge myself. I set a goal of personally delivering 1,000 meals by the end of the year, and Wayne's building happens to be in my delivery path. What makes this story so particularly painful is that I personally delivered emergency meals to Wayne's home the very day that his EBT card was not loaded due to the government shutdown a few weeks ago. Losing the benefit was instantaneous. It meant an immediate crisis for Wayne. When I got to his door, he was in tears. He said, "I'm so glad to get some food from you today, and I sure do appreciate you coming here and doing this." Now, this illustrates a core message. The need doesn't go away and wait for a new grant cycle. It doesn't wait for a private donation or for the government to catch up. It arrives the very day that the benefit is cut for the individual. And when the federal floor falls out, the crisis lands squarely on senior centers and local community-based organizations that help them. Next slide, please. Thank you. When we have hundreds of Waynes needing help every week, that individual crisis translates into systemic strain across all of our services. Now, this is what it looks like inside of a community-based organization. Our case management caseloads get more complex. Our case managers are spending significantly more time on crisis intervention, navigating bureaucracy, and tackling layered issues like benefit gaps and eviction risks. This is leading to higher and more complex caseloads. And now, as an aside, keep in mind that the city and state contracts that fund these services already afford very low wages for the same people who are delivering the services. And oftentimes, a case manager needs to access the same benefit that they're helping their client receive. There's additional strain on nutritional services. Loss of SNAP and other income supports leads to a surge in demand for our emergency food pantries. We see the potential for longer wait lists for core services like home delivered meals and case management. Older adult centers become crisis hubs. Our centers become overwhelmed with more emergency requests for food, heat assistance, and eviction prevention. And let me tell you, crisis crowds out prevention. Our resources are pulled away from proactive support and funneled into putting out daily fires. This means fewer resources for wellness programs, fewer resources for arts and recreation and other programs that can bring joy and companionship for older adults. And it means more resources are required to react to crisis, making the entire system less stable. Next slide, please. Now, as I mentioned earlier, Encore and community-based organizations like ours are what we call community care organizations. Our role is to serve as a community hub of non-clinical services to help people age at home in their communities for as long as possible. And this goal is really about avoiding costly hospitalizations in long-term care facilities. For example, just the other day, I had a meeting with a new community partner. It's actually someone that I was trying to get to donate to Encore. And she shared with me that her mother, now 92 years old, has been receiving home delivered meals since she was in her 70s. She is convinced that were it not for the daily meals offered to her mother at senior centers and now delivered straight to her mother's door through Meals on Wheels, that her mom would surely be in a nursing home. Like Kim said, the claim that these federal cuts saves money is a myth. It's simply cost shifting. We're adding tens of thousands of dollars to taxpayers for every single older adult who's prematurely hospitalized or sent to a nursing home. The money isn't saved. It's just kicked down the road. The burden is pushed down the line where it reappears as exponentially higher costs that are then borne by local and state government systems, hospitals, emergency services and shelters, community providers like Encore and other community-based organizations, and ultimately all of us, taxpayers. When an older adult loses HEAP assistance and has to ration heat in the dead of winter, or loses SNAP and forgoes necessary medication, they end up in the emergency room or they face eviction. That medical visit or that shelter placement costs taxpayers and the community vastly more than the original preventative benefit ever would have cost us. Now, let's be clear. Cutting preventive benefits is fiscally irresponsible. Next slide, please. Thanks. Okay, so we've established that the system, with all of the current and imminent benefit cuts, is on the brink. Not because of overspending, but because of short-sighted, destructive cost shifting. So the question is, what do we do now? In my opinion, we have a clear opportunity and a moral imperative, to reverse this damaging trend. Our priorities should be twofold: protect the federal benefits that prevent the crisis, and invest in local services that respond to it. We must protect and simplify SNAP, fight harmful work requirements and administrative burdens, ensure access for all eligible New Yorkers, including immigrant New Yorkers. Safeguard healthcare, prevent Medicaid coverage gaps by fighting work requirements and protecting marketplace subsidies for near seniors. Strengthen HEAP and other housing programs, restore federal HEAP funding, and prioritize programs that lower the rent burden for older adults. And invest in the Older Americans Act and the local Department for the Aging. Increase funding to meet the rising tide of needs and help absorb the shocks from federal cuts. Next slide, please. The policy fight is won not just with data, but with a human face. Every person in this virtual room today, and every organization and everything that we all represent, we have stories to share and a powerful role to play in shifting the political narrative. We have to make sure that our lawmakers hear Wayne's story, not just the statistics about benefit cuts, but personal impact. Here's another example. Recently, I was having lunch with Cheryl, an Encore board member. Cheryl has a very successful career, but she and her family still struggle with affordability because she is the primary caregiver for her mother. She asked me what she can do to make a difference and to help older adults and to help Encore help older adults. And I said, you know what, Cheryl? Have you ever thought about writing an op-ed, an opinion piece? And she said, you know what, Jeremy, I'll give it a try. So she drafted an opinion piece focused on the cost of caregiving, and now we're pitching to get it published, and I believe it will get published. But I want to read you the opening line of Cheryl's piece. The older woman in front of me at a CVS counter had 2 prescriptions, but only enough money to pay for one. One was her blood pressure medication. The other was allergy medicine, Claritin D, now close to $20 or $30 a box. She asked the pharmacist, which do I need more? Should she breathe comfortably or protect herself from a heart attack? Now, fortunately for this particular older adult, Cheryl paid and helped her get both of these prescriptions, but not everybody's going to be so lucky to be standing on a CVS line right in front of someone like Cheryl. Now, this is a powerful anecdote and not unfamiliar to many of us as we move through our daily lives throughout the city. And it's critical that we tell these stories in any way that we possibly can. Not only is Cheryl writing a piece, but she decided to take on her own meal delivery challenge and is committed to personally delivering 500 meals. And I invite all of you who are interested and who are able to take on your own personal delivery challenge, meal challenges, and deliver meals with me. Volunteerism is in and of itself a great way to advocate and make a difference. Another powerful and effective way to advocate is to call your elected officials. It's a simple 3-step process: story, impact, and ask. I recommend starting with your city council person. Just pick up the phone and call them. Then call the council speaker, the mayor's office, your state senators and your assembly people, the governor and federal officials. Now, I'm sure that Senator Krueger will agree that these calls really do matter. Elected officials have systems to count every single call that they get, and they track what the call is about. Lead with the story. Start with something specific, a very real-world example of how a benefit barrier caused hardship for an older adult, like Wayne, or like the story that Cheryl shared in her piece. Connect that story to the impact. Tie that story directly to a concrete policy failure. So, for example, hunger due to the SNAP shutdown or work requirements strain our home deliver meals programs, and cause coverage gaps for older adults in my neighborhood. And then propose a clear ask, an actionable solution. Protect the Older Americans Act, fund a SNAP, simplify or expand Medicaid eligibility. These are all great asks, and there are tons more. Coordinated messaging from community-based organizations, but most importantly, from individual New Yorkers, amplifies our collective message. We have to speak with one voice and shift the conversation from cost cutting to true community impact. Next slide, please. So in closing, I want to bring the conversation full circle back to the direct human cost. The strain we're experiencing as community-based organizations is a direct measure of the hardship being placed on our older neighbors. We cannot afford to treat essential human services as disposable. The stability of our clients, the stability of older New Yorkers, and the stability of our community infrastructure are one and the same. And I'll close just by reiterating the core message. Federal benefit cuts shift crises onto older adults and the local systems that serve them. Protecting benefits protects people, and protecting benefits protects our entire community infrastructure. We urge everyone here to champion these policy priorities, invest in local solutions that are already working, and fight to preserve the federal benefits that are the foundation of older New Yorkers and our country's stability. I know we have some time for questions and discussions, and so I want to leave enough for that. So again, thank you, Senator Krueger, for providing this essential platform. We do have a path forward, sustained investment, simplified access, and a commitment to seeing the older adult safety net protected is the way to go. Thank you so much.
Well, thank you. Excuse me. Thank you, Kim and Jeremy. Oh, I have to get the voice back. So Kim, if you'd put your, thank you. All right, so now with my sad little voice, I'm going to do my best to ask some questions of both of you, and either of you can choose to be the one to answer. And again, if there are additional questions people want to send me, send it to wherever my staff are telling you to type it in, and I should be able to find them also. And again, don't worry if you have more things than you can write down, because you're going to get all this material via email in the next couple of days. And I'm also recommending that you watch our previous related webinars titled "The Impacts on the Federal Cuts to Medicare and Medicaid and Changes You Can Make in Your Medicare Coverage in 2026. Both are available online and are very complementary to and important to the same populations that this presentation is so important to. So I guess, Jeremy, for senior centers, can you give us some other examples how cuts in the federal funding can negatively impact what senior centers are able to do for people who come to them for meals or programs or counseling, etc.?
Sure. So the cuts at the federal level, as Kim and I mentioned, they kick the burden down the curb, so to speak. And so it creates a situation where we have a hard time managing the volume of people who are coming to us for help. As I mentioned, we're contracted by the city at Encore, and most senior centers throughout New York City are contracted by the city to provide one meal a day, 5 days a week, right? Older adults, like every other human being, need to eat 3 meals a day and then some. We do our best. Many of us have emergency food pantries, and we give out, supplemental meals. We give out emergency food, and anybody that comes in and needs food, we do our best to get them to let them leave with food in their hands. But as benefits are cut, the need is just growing exponentially, and so it makes it harder for us to sustain that need.
Thank you. And SNAP, which is such a critical program for lower income seniors. And there are all kinds of threatened changes or soon to be implemented changes. But help me understand, if I'm a senior and I may be retired or working part-time, what are these new work requirements going to be for me, and what am I supposed to do?
Thank you for that question, Senator. Well, of course, it depends how old you are. So if you're in your late 50s, early 60s, you most likely will need to comply with the work requirement unless you can fit in one of the exemptions. That is the sad truth.
And that's through HRA, right? Even if you are a senior, SNAP is all dealt with through
Yes.
Human Resources Administration. Okay. And we sort of moved to a phone system for older New Yorkers getting SNAP. Is that going to have to go back to people showing up for appointments? Do we know that yet?
I think they're trying to avoid that at all costs, to be honest. Yeah.
Okay, thank you. How can adult home resident councils, because some people are seniors and they live in residences, even with their own councils, how are they able to show their concern for what is happening, or perhaps get coordinated help for everybody in their buildings?
I would say speak up. Um, so if I would say start with the leadership of the residential building. Partner with that leadership. Go to the community board. All the different ways that we can advocate as individuals. I think that councils and membership leadership groups have a multiplier effect when they work together and advocate. I've show up to the New York City Council hearings on aging. Those are places where council members are a captive audience and they're listening to all the various issues and needs and concerns. And I've sat through those council hearings and I've heard firsthand council members, hear testimony from individuals and from councils in their own districts, and then they turn around and they take action and they do something. They may have discretionary grants that can help, provide additional resources. But if anything, they will help you advocate for what you're entitled to.
And my staff just reminded me that the first webinar we had this year in our virtual roundtable discussion was about how do we fight back and advocate for ourselves. So again, I refer anyone to go listen to it or watch it on our YouTube channel or our Senate websites, because once we do these webinars, they're there forever. It's just a question of how easy is it for you to find it. So if you're trying to find that one and you can't, when you call my office, they'll help walk you through. But it's a very valuable tool. And if there's anybody who's watching our webinars who has not yet requested our senior resource guide, I don't know, where have you been? You should be asking us for one. We're going online on our websites and just downloading if you like everything on the internet. We spend a lot of time, effort, and valuable intern effort to update our senior resource guide every 2 years. And we talk to everyone who's in it and we learn what they're doing nowadays, because they may have changed since 2 years earlier. They may have expanded, they may have reduced. And we have a very good index in the resource guide. And what I've been told many times by constituents is, if it's for older New Yorkers, it's going to be in there. So get a copy of this and take a look. So when you're looking for something to help you answer the questions, ask for another copy of the guide if you lost yours. and just make sure that even groups you are going to and working with know about these resource guides.
Senator, we'll make printed copies and make them available at our older adult centers.
Well, thank you. And we can also get quite a few of them printed up by the Senate.
Thank you.
Thank you very much. So are there other advocacy issues you think older New Yorkers should get really involved in now beyond the issues we're talking about today? I know that LiveOn New York does all kinds of advocacy for older.
I'm sorry, Senator, I was responding to a question in the chat. Could you repeat that question, please?
Sure. Besides the issues we're talking about today, the cuts in SNAP, HEAP, cash assistance, and older adult center funding, are there other important advocacy efforts that LiveOn thinks everybody should know about and perhaps choose to get involved in?
Well, we have our Age Strong campaign, which is going to ramp up. Well, it's ramping up now in time for the state legislature to come back in session in January. So you could definitely go on our website and learn more about that. That is our big advocacy effort. And then it's usually May or June, we do a lot of work on advocating in front of the city's council. So you can find out more information on our website.
Great. Okay, and yes, somebody asked through the question and answer little box that they wanted the contacts for the other webinars we've done, and we published all those on the chat, so take a look. Excuse me. So do we know anything about cuts or elimination of coverage for vaccines for older New Yorkers?
I'm not aware, Senator Krueger.
I don't think they've cut any of the benefit eligibility for paying for vaccines in New York. Although there's a great deal of concern that these vaccines will be harder to get over time as the federal agencies responsible seem to be making announcements that they're not sure these vaccines are needed. So let me just say, for the record, don't not get vaccines unless you have a personal doctor who says you're one of those rare people who shouldn't get X, Y, or Z vaccine. They are safe, they are critically important, and as we get older, and therefore we do become more vulnerable, even to stupid head colds like me, you have to be getting the vaccines to protect yourself and your family and anyone who goes near you. So if you're listening to somebody who's telling you don't get vaccines, you're listening to the wrong people. We even have several webinars from several years ago by immunological experts taking on all the anti-vaxxing false information going on out there. And it's getting worse. So we have to make sure we educate ourselves. We talk to people in medicine with actual medical degrees who we trust about what kind of vaccines we should be getting. And pretty much everyone with a medical degree is going to tell you, yes, get the vaccines. You're putting your life at risk. You're putting your grandchildren's lives at risk. And you're putting your neighbors' lives at risk. Just get the vaccines.
Yeah.
Next question. Do we think there's going to be any pushback on the Medicare premium increase that nearly zeroes out what the Social Security COLA increase is going to be for 26? So basically, people on Social Security are going to be receiving a cost of living adjustment. But when you do the math on that versus the math on how much Medicare premiums are going up, you'll still be in the hole compared to 25. Do we know of any ways to stop that from happening?
So I do know, what I do know is that the percentage of the COLA is dependent upon the consumer index. So it's really, that's, that's what it's determined by. I don't think there's any wiggle room for that at the moment.
And if I can just add to that, when I'm in conversations like this, I try to think about, what can I and my friends and my colleagues and my family most control or most impact, and I really think about our very very micro local government. Um, so the senior centers and the nonprofit system of organizations that support older adults in New York are by far and large funded by the city of New York, not the feds, and quite frankly, not even the state. And so what I would say is the more we can advocate for investments into older adults at the city level and at the state level will help us offset some of these horrible cuts that are happening and coming down the pike, at the federal level. I mean, it should none of it should be happening. But I'll give you just a very specific example. Like I said throughout the presentation, we are funded to provide one meal a day, 5 days a week. I can't say that enough. And we fundraise and we partner with other organizations to provide one meal each on Saturday and Sunday. There is legislation in the New York City Council that is proposing that the city fund one meal a day, 7 days a week. That would give nonprofit organizations room to fundraise around something else. Because right now we're spinning our tails fundraising just to fill in that sixth and seventh day meal, where we could be fundraising, to innovate and to provide socialization programs and arts and culture programs and fill in other gaps in other ways. And that's a very real issue that if New Yorkers speak up about, it could actually pass and happen.
That's great. Thank you very much for that.
Senator Krueger, I'm sorry, can I expound on that question or respond to the question about the Medicare premiums versus people may already know this, but there is a program called the Medicare Savings Program, and that assists people in having it. It will pay the Medicare Part B premium that's usually deducted from your Social Security. And it also, if you don't have free Medicare Part A, it will pay for that as well. And that could be upwards of $300 a month. So I don't know if the person who spoke or message is eligible, of course, but if you'd like to be screened, please feel free to give us a call. But that is a program that helps with the premiums.
That's great. Thank you. And I was going to also point out that for anybody who didn't watch our webinar with HIICAP, which is the program through Department for the Aging, where they have a one-on-one conversation with you and your situation, and then they advise you which of the various Medicare or Medicaid programs you might be eligible but not recently receiving, or which one of the private supplemental programs might be in your best interest based on the types of medicines you're on. So some people here were asking about if you only get to change this once a year, is it too late? And here's my recommendation. Yes, there are certain months during the year that you can make changes, but it's also true that if your circumstances have changed, it's possible you could be eligible for something now without having to wait another 12 months to give it a try. So I always encourage people to give the HIICAP program a call and to go through a review with their really extraordinary experts and volunteers. And you may very well find that's something you haven't been participating in, you are now eligible for, and you are even eligible for at this time without having to wait months and months. And so one of my staff is going to pop up the phone number for HIICAP in the chat. But again, if you've got my resource guide, it has the information in there. Or if you watch that webinar and still have it in your computer, it has all their information in there. It's a really great government service as we get older And it seems like health insurance realities just keep becoming more and more complex. To have somebody who, they don't work for a private company, they're not trying to get you into a specific plan. Their job is to evaluate based on what your needs are, what your eligibility is, and what kinds of, even in medication you are taking on a regular basis, what's the way to make it cheapest for you. So there in our chat is the HIICAP helpline phone number, 1-800-701-0501. If you know anybody who's older than 62, you should make sure that they have the HIICAP phone number and just say, you should do a review with them. You never know what you might be missing out on. Even as all these changes keep coming down the road, and almost none of them seem to be good changes. Okay, I'm just seeing whether any more came in. Does anybody know if we're going to be seeing fewer social worker options for older New Yorkers based on any of these cuts at the federal or local level?
I mean, I'll comment on that, Senator.
Sure.
So our caseworkers and our social workers have very high stress jobs as it is. And so when these caseloads become more complex, there's a vicarious trauma that they take on, as you know, as happens throughout the field of social work. A challenge, though, in aging services is that social workers in aging services are paid horribly lower than social workers in other fields. So a social worker at a New York City senior center or a social worker at a New York City case management program is going to make anywhere from $45,000 to $55,000, in many cases with a master's degree. Whereas that same exact social worker with those same exact credentials could go work at the New York Health and Hospital System or in the DOE and make six figures, as they should be making six figures across the board. So, and the low pay levels is a result of underfunded city and state contracts, right? So this goes back to very hyper local city and state advocacy, right? We need to be pushing the folks that put together our budgets to properly fund budgets across the board so that human service staff members are making livable wages. And I'll do a plug for a sister advocacy organization, the Human Services Council of New York, HSE, which has a campaign called Just Pay. And the Just Pay campaign focuses on exactly what I just mentioned. It's ensuring an equitable and livable wage for essential nonprofit human service workers throughout the state. So check it out on their webpage, the Human Services Campaign, Just Pay.
Thank you. And that just popped up also on the Q&A. I don't know whether you were typing it in or someone else.
No, that wasn't me, and that's exactly
you
Just
had
Pay.
the same good
Yeah.
idea at the same
Yeah.
time. Well done.
Yeah.
Well done. Okay, just double checking. HIICAP gives regular live 90-minute webinars on Medicare for free. Eric Hausman presentations are very helpful. Yes, we had Eric do a webinar for us, I think several years in a row. His knowledge base is amazing. I'm going to post the link in the chat. Yes, 2 sessions coming up. Thank you very much. Oh, see, people who are in theory asking questions are just giving us additional good information to be sharing with each other. So thank you very, very much. And even though we're a few minutes early, since I think we might be out of questions and I'm out of voice, I'm actually going to probably close this down a few minutes early, just by again, thank you, Kim. Thank you, Jeremy, not just for your work with us today, but for your work all year round and your organization's work. That means so much to so many people. And thank you to everyone who attended today's roundtable. And many of you followed us for the last several months in all of our roundtables. And not to worry, we'll be doing more of them in 26. And of course, to my staff, without whom I could barely get anything done, certainly not these. So everybody takes turns, but today we have Nate and Justin and Ian running the show in the background. So thank you all. A reminder, a new edition of our older adult resource guide is available in print and online, as I already mentioned. If you want a hard copy, you can email our office or call. And there's information in the chat. And if you want to access the guide online, you can just click on the link in the chat. This is our final roundtable in this year's Older Adult Roundtable series. You can view all the roundtables in the series and all other virtual events my office has hosted on my YouTube page or at krueger.nysenate.gov website. The best way to learn about upcoming events is to sign up for our email list by emailing Liz at lizkrueger.com and make the subject line join Liz list. Now, if you join Liz list and you decide you only want to open them sometimes, no problem. No trees were killed. No postage was wasted. If you like it, share it with others. If you decided it's not that interesting, you can get off the list, but there's no penalty for not reading the emails, even if you stay on the list. It's very efficient email, I have to say. I want to wish everyone happy Hanukkah, Merry Christmas, Happy Kwanzaa, Happy New Year. And I think there are some big fans of Festivus out there, although I still haven't totally learned what that is. But how can you argue with another holiday personally? I want to thank you for joining us today. Everybody stay healthy. Everybody get vaccinated. And you know how to find me in my office whenever you need to. So take care. And again, to my two guests, thank you so much for spending this time with us.
Thank you.
Senator. Feel better.